Sure, so Daratumumab is a CD38 monoclonal antibody that's approved in the treatment of multiple myeloma. So CD38 is actually present in a lot of different immune subsets, many of them that are considered immune suppressive in tumor microenvironments. And so these can include macrophage populations, these can include myeloid-derived suppressor cells, and others. And so we wanted to look and see if we targeted these populations, could we result in activity against renal cell cancer and also muscle-invasive bladder cancer. The study was conducted during the COVID time. It was very, very slow to accrue, and we actually stopped the accrual about halfway through. What we found was very limited activity of Daratumumab, but we were able to influence the tumor microenvironment in both bladder and kidney cancer, clearly targeting these CD38 populations. So as a single agent, it's unlikely to have significant activity, but potentially partnered with other drugs, it could influence the immune microenvironment favorably. It may be worth considering those types of strategies in the future. One of the interesting tidbits, and I'll be discussing this in my presentation on Saturday, is that what we looked at were patients that were untreated on a separate trial versus the patients that went into Daratumumab in terms of what their immune tumor microenvironment looked like. And after immunotherapy and drugs like Cabozantinib, the immune microenvironment is very depleted. So you have a lot less T cells, macrophage, NK cells that are present. And so the timing of these drugs is going to be critical to look at when we're trying to manipulate the immune system to give a more favorable cancer response.